breast cancer diagnosis is a bit of a different story. You can present either with an abnormal mammographic finding and you'll be called back for additional imaging, or your healthcare provider may have found an abnormality on your breast examination. In that case, first of all, don't panic. Most findings on a mammogram or on a physical examination are benign. They're not malignant. However, you will be probably subject to additional imaging. Additional mammographic views may be obtained, or they may ask you to have an ultrasound. An ultrasound is a painless way of looking at usually masses in the breast to see whether or not they're cysts. Cysts are merely sacs of fluid, and they're not cancerous or precancerous. So ultrasound is very helpful because some lumps can just simply be a cyst. However, some lumps aren't, and some mammographic findings may not clear up with the additional mammographic images. So then what do you do? In the old days, you used to go for surgery, and now, in fact, we don't recommend surgery unless we're treating breast cancer. Breast cancer can be diagnosed effectively, efficiently, with minimal scarring, and accurately with a technique called core biopsy. The object of core biopsy is to sample a lesion. If it's benign, it averts an unnecessary surgery. If it's malignant, it helps the surgeon decide what kind of surgery they need to do subsequently. Core biopsy can be performed with fingertip guidance if you can feel it readily. It can be performed with mammographic guidance, and we use a special table where you lie on your stomach, and that's called stereotactic imaging, using angled X-ray views to target the lesion. Core biopsy can also be performed with ultrasound guidance, which is a preferred way whenever possible, since it's accurate and you can visualize the lesion as you're sampling it, and it's much more comfortable for the patient since she's usually lying on her back. So that's the way to biopsy without having to go to surgery. 80% of the time we do biopsies, generally, they end up being benign. However, some patients do require surgery. The important thing to remember is if you have a mammographic abnormality or find an abnormality on your physical examination, don't panic. Most of the time, it is benign. But that leads us to our next segment. What if it is breast cancer? What are my treatment options?
To watch the other segments in this video series or for how-to videos on almost any other topic, visit monkeyseed.com.